We were approached by the leadership of Police Scotland, who were telling us that they were receiving 3 million calls a year from the general public, of which only 20% were crime-related. And the rest were to do with policing responses to people with vulnerability or mental health distress, or who had taken drug or alcohol overdoses. And there wasn't much evidence-based policing around what you do in those sort of circumstances.
Many of the really complex issues that communities and individuals face, services can't individually address those themselves, that we actually need to collaborate. That is how our work is developed, to look at those really sort of quite complex issues at the intersect of policing and public health.
One of the specific projects that we were invited to evaluate by Scottish Government was the police carriage of naloxone. Naloxone is an antidote to reverse drug overdose, specifically caused by opioids. And Scotland has got unprecedented rates of drug-related deaths and is the highest in Europe.
Policing in Scotland's kind of different from policing everywhere else because we have, as part of our mission, a responsibility to improve community wellbeing. And this was part of it. So our involvement in what was established as the Drugs Deaths Task Force was to see what role policing could play in improving community wellbeing, particularly in respect to reducing drugs deaths, addressing addiction and the problems associated with addiction, etc.
Police were proposing to carry naloxone so that when they were first on scene to attend a drug overdose, they could administer naloxone and potentially reverse that overdose and save lives. It was not known whether officers wanted to carry naloxone, how they felt about doing it, and they also didn't know whether the general population, how were people in the communities going to feel about people responding and administering this first aid intervention to reverse drug overdoses.
We've had over 400 interventions in respect to the use of naloxone, and not every occasion would the person have died. Even had it only been one occasion, and that in itself proves its worth. We would have not achieved that policy change for policing without an independent academic study telling us and showing us the results from a pilot phase and the potential there.
Our hopes for policing and public health is that it moves from being an emergent area or field of practice and it becomes normalised instead of thinking of us in total silos. One of our key strategic objectives from the university is to really make an impact on people and communities, bringing together our policing and public health, research, education, practice and policy work really reflects that and allows that to happen.
Academia provide us with that strong evidence base. You know, there is strong arguments out there and very traditional views of what policing is in Scotland and the broader UK as being crime fighters, but in actual fact crime it only accounts for about 20% of our demand. The other 80% is various types of vulnerability. And to be convincing in our approach, respect to moving into these other areas, we rely on our partners to help us demonstrate the need for that. I would like to see policing in 5 or 10 years having more of a presence and an influence in this space. The potential of policing is an awful lot greater than just catching criminals. And I'd like to see us tapping into that a lot more in the years ahead.